Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky. Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky.
Hello, everyone, and welcome to today's press briefing on the coronavirus. I'm Donna Bush. Welcome to our listeners on Radio Cayman, our viewers here on CIG television, as well as those who've joined us on our social media platforms. We go now to prayer from Pastor Hussam Rochez.
I'd like to start by reading a Bible verse, Romans chapter 12, verse 12. Rejoicing in hope, patient in tribulation, continuing steadfast in prayer. Let us pray. Father God, we give you thanks, Lord. We thank you, Lord, for your love. We thank you for the government, Lord, and the panel that you have put together, Lord, to guide us through this global pandemic. We thank you, Lord, for the governor, for the honorable premier, for the minister of health, the police commissioner, and the chief medical officer. We ask you, Lord, today that let your power be known, Lord, not by words nor by might, but by the power of the Holy Spirit. That you surround us, Lord, with love, Lord, and rejoicing, Lord. That your people may know, Lord, that we may come to you, Lord, in rejoicing, proclaiming your name and praising you, Lord. Because we know, Lord, that no weapon formed against us shall prosper, Lord. And that we know, Lord, today that your people of this beautiful Cayman Islands, Lord, will be touched by the Holy Spirit. I pray for the sick to be healed, Lord. I pray for the disease to disappear. I pray for the wisdom, Lord, of the scientists, Lord, that you may give them supernatural understanding, Lord, that comes only from the heaven to find a cure. to find a vaccine. And we pray for protection over the borders of this Cayman Islands, Lord. And we pray, Lord, that for the people of this island may understand whatever measures that the government put in place, it is there for our own safety. And that we must understand and obey them as we obey and be submitted to you, God. We thank you, Lord, for everything that you have done for us in the past, for the present, and for the future to come, because we know that we are glorious in victory for thy name's sake. And I cover every and each one of us in the precious blood of the Lamb. And I declare that we are in health, strength, and that we may go forward proclaiming to the nations that you are God and true God. In the name of Jesus, we say this prayer. Amen.
And thank you, Pastor Rochez. We now welcome our panelists, His Excellency the Governor, the Honourable Premier, and Minister for Health. As well, joining us in our studio, we have the Chief Medical Officer, the Commissioner of Police, and the Director of Hazard Management Cayman Islands, as well as our sign language interpreter. Also joining us by Zoom, we have the Medical Officer of Health and members of the media. We now go to Dr. John Lee.
Good afternoon. I have a further 12 cases to report today, which are all negative. That brings our total tested to 702, the total negative to 641, and the total positive unchanged at 61. There is no change to the clinical symptoms of the people that I reported yesterday. I am delighted to say that we've been able to get one of the senior scientists from PAHO to review the processes at the Doctors Hospital, examining their processes of providing COVID-19 testing. They are happy with the processes and pleased with the safety arrangements that have been put in place, and so we're in active discussion with them to agree when exactly they will start testing alongside the Health Services Authority. Today I thought, as it's Friday, I might give you a little presentation. It's fairly scientific, so please bear with me. I'll try and hopefully make it understandable to all. But the first thing I wish to say is the first slide has got some rather shocking details on it. A lot of people have asked about where the facts and figures have come from, and this is essentially where they have come from. The modelling that was done in the Ministry of Health several weeks ago in February, in fact, when this first started to blow up. You'll see on that slide that the worst case scenario is that 80% of our islanders will be affected. That percentage is the same figure that governments around the world have been looking at in order to try and get their heads around and begin to plan for what they're going to do to look after their citizens. When we say the worst case, the reason we use that phrase is because we've done an awful lot of things to mitigate that factor, and I will talk about that as we go through the presentation. But these are the figures that shocked everyone, and these are the figures that people have been quoting to you in various parts. When we say 80% affected, figures have varied between 60 and 80, and if you vary that at 60% or 70% or 80%, you'll come across with different outcomes. But we can see on the slide that I hope you're able to see in front of you, 13,000 people would not be affected in Cayman. 52,000 people out of a total of 65,000 would be affected. Those mildly affected or not affected at all would be 84%. So a large proportion of people will get through it. They may be feeling very sick in bed and have a fever and feeling really unwell, but they wouldn't need to go to hospital, and they would make it through it on their own, under their own steam, so to speak. But 4,160 would need hospitalization, and that's likely to be over a 60-day period. That's the prediction that if you don't do anything, that's the period over which you will have an infection problem, and that's the figure that clearly worried everyone. the last figure speaks for itself. 910 possibly dead in the worst case scenario. That's why we've been working so hard, and that's why we've been so concerned about this right from day one, everybody, especially at the top table. Well, that wasn't so good, was it?
I'm going to put it back up for you.
Thank you. We go to the next slide, please. Thank you.
I think you have to.
That's what I did the last time.
Oh.
Just press the down arrow. Okay. So thanks, Donna. So this is the next slide, and it gives a visual representation of the number of cases that we've had dating back to the first case. Well, it wasn't the first case we know arrived on the island on the 29th of February, but actually the date that the sample was taken and sent to the lab and was the 7th of March. And on the bottom scale, you'll see dates stretching up until mid-April, starting with the 7th of March date. On the left-hand axis, you'll see a scale from 1 to 8. So that first patient on the 7th of March hits the first line, which represents one patient. And then we can see there are more patients as we go through. What the orange line shows is, rather than a cumulative total, what it shows is a 7-day moving average. And that sounds a bit complicated, but basically it's smoothing the line. So instead of all the jagged lines, you actually get a more smoothed approach. And you can see that at the moment, the line is not continuing to rise. It's actually falling a bit, which is good news. It means that the suppression that we have been employing very hard since for the last 3.5, 4 weeks has been working. Next slide, please. Thank you. This is a more complicated diagram, and I first of all want you to focus on the top diagram. You'll see there's a black line that between April and July, it shows a great big rise and a peak up to about 280 on the axis on the left. And that represents the number of intensive care beds that would be needed per 100,000 of the population if you have an explosion of COVID-19 without any mitigating factors, if we don't do anything about it. It also shows a number of other lines which show increasing numbers of mitigating factors or things that can be done in order to suppress the disease. And the bottom one, the green line, is when you put in maximum suppression, which means you close schools, you close universities, you have social distancing, you quarantine people and isolate them when they're sick. And now if you now look at the bottom graph, you can see that that green line shows a peak only at 5 intensive care beds per 100,000 of the population. So that's with a lot of suppression, all of which Cayman has put into place. The difference between the tall black line at about 280 and the green line at 5 intensive care beds per 100,000 is a factor of 56. So we can reduce the effect of the virus by maximal suppression by 56 times, which is huge. I've said before, and I'll say again, we have in Cayman around 50 ICU beds, intensive care beds per 100,000. And with maximum suppression, we only need 5. So we are well provided for intensive care beds in the island. And with maximal suppression, our hospitals will be able to cope. That's what we've hoped for, and that is what we have achieved to date. Our hospitals are not flooded with patients. We've managed to keep people out of the hospitals largely. And those that are there had received good care and are making it through. Obviously with the proviso of the first very unfortunate death. The next thing I would like you to look at is what happens in October, November on that graph. So on the top graph, look to October, November, and you can see that even that green line jumps up. And why does it jump up? That's what will happen if the suppression is stopped and we do nothing else. So we will get a resurgence because this is an exceedingly successful virus. It's good at infecting people, it's good at being transmitted from person to person, and it's good at hiding away. So it is one of the most successful viruses that we've ever known to have existed in man, which is why it's producing such a devastating effect even in this century that we're in now, which we all clearly think is the most modern, and it should be, and it is. But it's got the better of us. That is what the government is trying to decide on how to manage, and not just this government, but absolutely every government in the world. How do we prevent the bounce back and the potential deaths, the potential hospital admissions that I showed you on the first slide that was so worrying. We're in the suppression stage, so we're safe, but we need to come up with good plans of how we're going to get out of that situation. Of course, the best answer is going to be a vaccination, which would protect everybody. That's not here yet, and it could well be a year or more until that arrives if we're able to get it. There's always an if with vaccines. There's never a surety. The last slide I wish to go to is actually to give you a little bit more science about the testing behind this, because testing is likely another way we may be able to fight our way out of the situation that we find ourselves in. On the slide that you can see in front of you, you'll see that viral RNA, the ribose nucleic acid, the viral material that we detect with the polymerase chain reaction, that's what we detect when we look, that's what we use to detect the viral RNA. We can see that that rises very early in the infection. That's what the black line and the orange line are about. Well, the black line, really. The orange line is showing that there are virus particles in the blood. And when there are virus particles in the blood that the body recognizes as being foreign, the body starts to react against them, and it produces immunoglobulins. The first one to be produced is IgM, immunoglobulin M, and that will start to fight the infection immediately, but also the long-term memory of the infection is produced by IgG, immunoglobulin G. And we can see towards the right-hand side of the graph, we have IgM rise first, and then IgG rise later. We know now with this virus that IgG rises and is maximal at around 28 days after an infection. IgM also rises, but as you can see from the graph, it's actually the PCR test that's going to recognize that you have this infection first, because that's the thing that can be detected first by the PCR machine. After that, you may get blood changes to show the IgM and the IgG. The problem with testing for IgM and IgG also, and we are being bombarded at the moment, the ministry and so many other places, by the potential to do mini blood tests and so on and so forth. The problem with the IgM and the IgG is the IgM is not very specific for COVID-19. That means other things can make the test become positive. So that's not really a very good test. The IgG may be a good test to say you've had COVID-19. There again, even so, even the laboratory tests, which are the best tests for IgG, have not been shown to be robust enough to reliably detect it. There's another issue too on that score. Only 90% of people who have COVID-19 get a rise in IgG, so what about the other 10%? This bit of science will resolve itself with time. We're going to have answers about the immunoglobulin testing. They will probably come before the vaccines come. I'm expecting them to come along a lot before the vaccines come, and they may enable us to say this person is probably going to be, has had the infection, is probably going to be safe, and this person is probably not. But that still leaves us with a problem in Cayman, because a lot of the population have not had COVID-19 and therefore won't have had a rise in IgG. You may have heard about this thing called herd immunity. That requires a lot of the population to have had COVID-19, but we've been lucky enough. We've kept people out of the hospitals, so that means that we have kept people from having COVID-19, or else we would have had a lot more people in the hospitals. So we go back to actually the PCR testing, which is the testing that we're doing currently at the Health Services Authority, and the Doctors Hospital are able to do and will be doing very shortly. And it is through that testing that we may find a way to relax the restrictions that we have and allow people to go back about their normal business. But it's a grand project. It's a big project, you can imagine, in order to do this, not only from the laboratory side of things, but also from the organizational side of things. And it's not a question that we will be able to do the test once and say, you're good to go. As I've said quite a few times before, the test is good on that day, but if COVID-19 is still in the community, and I can assure you it is still in the community, hiding there, when it starts to come up again, we'll still need to get people to isolate, to be quarantined at their own homes, and to put a ring fence around them and all their close contacts. And it is possible that lockdowns will need to be introduced again and again and again in order to try and keep people out of hospitals and to protect them. This is all why we wait for the vaccine. I hope that's been helpful. I'm happy to answer any questions to elucidate a bit more. Thank you, Donna.
Okay. Thank you, Dr. Lee. We're going to go first to Wendy at CNS. She has a question for you. Wendy, please go ahead.
Thank you, Donna. I already had this question anyway, so that it's even more pertinent now. Obviously, the testing is very important. The Premier has said it many times. We need to test, test, test. How are we doing? I understand that there are still, we still don't have everything we need. So what's your prediction, Doctor, for when we're going to start rolling out this ramped up testing program?
It's starting, Wendy. Wendy, I had to tell you, I mustn't forget to tell you, I need to give you a correction. It's starting already, Wendy. So we're doing what we call a soft launch. We want to get all the systems up and running, but we're actually starting to run more tests through the laboratories. We don't want to move too fast because we need to test all the systems that they're all ready to go up and to accept the increased numbers of tests. I would imagine that by the end of next week, we'll be able to say something more formally about that. You can imagine that if we're going to be testing large numbers of the population, it will need to become a factory-like conveyor belt process that we'll need to ramp up and get to. And we're probably going to need help beyond just health. We're going to need organizational help on a grander scale. The limiting factor at the moment is the extraction kits. This is the thing that you need in order to prepare the sample to go into the PCR machine. Things are getting more hopeful on that front. We currently, I can't remember the exact number, have the ability to do about 4,000 or 5,000, I think, on the island. And we have a lot of very hopeful leads and the promises from Crown agencies who supply the UK government that they are able to get us a supply, which is on its way. But it's going to come in weekly aliquots, weekly amounts, rather than as a bulk order. But the ability to get hold of the extraction kits appears to be loosening, even in the last week, as I've seen. The other thing is that you asked me yesterday about the number of locally acquired, and I said I thought it was less than 6, and you were right. I think it's actually 8. I haven't got that graph from me, but I think it was actually 8 when I looked at it yesterday, Wendy. I apologize for that, and I hope you'll accept my correction.
Thank you.
Okay, we're going to go now.
Question.
We're going to go now to Reshma from the Compass.
Thank you. Good afternoon, Dr. Lee. Can you share how these numbers were determined and what model was used by local health officials to arrive at these numbers?
Which numbers, Reshma?
The projections that you gave, the worst case scenario.
The worst case scenario were figures that I provided to you and provided to the government. The figures have come from there was a very large epidemiological study, which I mentioned a few weeks ago, by the WHO and a number of other international scientists who went into Wuhan and did this epidemiological study, which has produced a lot of the statistics that we're currently relying on. They've been refined somewhat. The hospitalization rates have been refined somewhat because Western style of medicine is not quite the same as that in China. And so there is some refinement, but essentially the really worrying figures that you saw came out of that original, the original estimates, and then have been applied to the Cayman population.
Thank you. So based on your projections, where are we right now, given our figures that we have, the 61 cases, the negatives that we've received?
We remain in suppression on that green line.
Okay. You talked about COVID-19 task force. Can you provide us with an update on how the task force has been working and what are some of the key areas of focus they are dealing with right now?
I think I have a feeling you're talking about the professional task force that has been writing
Correct.
The clinical protocols for management.
That's right.
The final draft of the document was circulated to everybody yesterday for final comment and should be completed, I suspect, today, as final comment was requested by today. But it's essentially, it's been written. But it won't be a static document, because as we get more information about whether there's some immune therapy, whether there's some biologic, whether there's a new drug, whether it be a drug that's used to worm horses that we can use, and I'm not saying that flippantly because there is one. There's ivermectin is a drug that is a worming tablet in animals. It has actually shown a lot of promise to suppress the virus. So whatever new information comes will be fed into that clinical guideline.
Okay, Rashma, we're going to move to Felicia at Radio Cayman now. Felicia? Okay, Felicia is not there. We'll move on to the Caymanian Times. Ralph Lewis?
No, I'm here.
You're there? Okay.
I'm here.
Please go ahead.
Sorry, my mic gave trouble. My question is for the Premier. Has the U.S. seized any more of our medical supplies? If so, what? And if not, what measures did we take to make sure nothing was stopped from coming into Cayman?
As far as I'm aware, nothing has been interrupted since the first and only case that we're aware of, which we happily resolved. I'm not sure we can take many measures to determine what the U.S. do. We just have to try to work through diplomatic channels to ensure that we get things that we order. But we are also trying as far as possible to avoid routing things through the U.S. or purchasing things from the U.S., which we think may be subject to the executive order.
And just one last question. As we move closer, hopefully, to the reopening of the local economy, you have said before that the schools will be one of the last things to reopen. And for many parents of school-aged children who don't have alternative childcare options, this raises some concerns for them. They are unsure of how they'll be able to go back to work before schools are opened, or if there are any childcare facilities that are open for them to take their kids to, leaving them with no childcare options or no job if they can't work. Is government looking into that aspect when planning for reopening?
Well, I can't say that I am privy to any specific discussions about that. I'm not, but I'm certain that those things are being taken into account. I mean, as I indicated before, my view is that schools should not reopen before what would have been the start of the next school year, and even that is under constant review and revision, and will be determined by the state of affairs that we're in when we get to late August, early September. There's a lot of things that we don't know. There's a lot of things we don't know about this virus. And we're learning lessons all the time from what's happening in other countries. And those are going to continue to inform the decisions that we make. I think so far, as the results have proven, I'm always fearful of saying this. I think that the strategy is most definitely working, the suppression one. But when we look around the rest of the world, we see cases continuing to pop up, and indeed even instances of a second wave of infections. All of those things have to be taken into account and to continue to inform the decisions we make and the strategies we employ. Because first and foremost must be the preservation of health and life. All other considerations are secondary.
Okay, thank you. That's all my questions.
Thank you, Premier. Dr. Lee, I do have a few questions from the public for you. One is with the number of positive cases that from asymptomatic persons compared to those who were symptomatic. What's the concern there? Is there any concern there that number is just as high with asymptomatic persons? And if so, what plans are in place to address that issue?
I think the number of asymptomatic cases is not clear. Certainly we've had some. There's no question about it. I haven't seen a large epidemiological survey. When we start to test widely, essentially that's what we will be doing, Donna. We'll be doing a survey. and we'll be able to see from our own results if somebody was asymptomatic, who the positives are. And that might be the best test for us, which we don't have the answers to yet, but the best test for us and the most interesting.
That leads me to the next question. What would mass testing look like for a Cayman community? Obviously, some countries have done like a drive-through kind of testing format or system. What would it look like for us?
The people that have been discussing the testing have been talking about that, because drive-through enables the least amount of contact, because somebody is actually in their own environment and is therefore protecting the tester. But not only protecting the tester, but so that the tester is the things that the tester is wearing are also not exposed to the patient or to the subject, or else you have to take more precautions. So the drive-through is something that is likely to be the way that we do it. Even if you work, for example, in the hospital, it may well be that the hospital says, "Could you please go to the drive-through at 2:30 on Wednesday? Could have your test done?"
Okay. All right. Thank you very much, Dr. Lee. Okay, now we're going to call on the Commissioner of Police, Mr. Derek Byrne, for his update.
Good afternoon. Your overnight report then. Quiet overnight. No significant issues of a policing nature to report. Crime still remains stable and the hard curfew continues to operate well. Little Cayman overnight, no issues to report. Cayman Brack, 19 vehicles stopped by police, no breaches of hard curfew detected. Grand Cayman overnight, 231 vehicles stopped by police, no breaches of curfew detected. 2 pedestrians found out and about in breach of hard curfew, both warned for prosecution. One of those same persons was found 2 hours later, again in breach of hard curfew. On this occasion, that person was arrested and conveyed to our custody detention centre. Since 6 a.m. this morning, a total of 10 persons were found in breach of curfew, or found in breach of shelter-in-place regulations. 4 persons were found in breach of hard curfew, and 6 persons were found in breach of soft curfew. 3 persons were found on the beach in breach of hard curfew, and 1 person was found operating a commercial landscape business this morning in breach of hard curfew. All 4 were warned for prosecution. In respect of the 6 persons found in breach of shelter-in-place regulations, they were mainly drivers and 1 pedestrian. They have all been issued with tickets. Business this morning at supermarkets, banks, pharmacies and gas stations are operating well. They're being well managed and well controlled, with social distancing protocols being observed. Our helicopter and marine units remain deployed on extended tours, monitoring marine and ground activities. 2 issues to mention today. An issue in which we are receiving a number of reports is the large number of persons out and about exercising on the boardwalk along South Sound. Morning and evening. It is reported that persons are congregating in groups of more than 2, stopping, speaking to each other casually. Social distancing protocols are not being observed. Police resources have been directed to pay particular attention to the area. And you will recall the revised exercise periods are from 5:15 a.m. in the morning till 6:45 p.m. in the evening, Monday to Saturday. A second issue, just the social media messaging going around, some piece of fake news that the police service have notified an early lockdown of all services. This is not correct. It's not true. No conversation has taken place with His Excellency the Governor or the Premier, so has no application whatsoever to the Cayman Islands. There is no intention in the short term of a full lockdown. A reminder that we return to full hard curfew this evening at 7 p.m. until 5 a.m. in the morning. During these periods, no persons should be out and about away from their homes. If you are not exempted as essential services personnel, please stay at home. Police mobile and static patrols will be in place across the islands to enforce the curfew and shelter-in-place regulations. Access to public beaches remains in full lockdown or hard curfew on a 24-hour basis until 5 a.m. on Friday, the 1st of May 2020. And just looking at this coming Sunday, the 19th of April, we are in full 24-hour lockdown or hard curfew. This means there is no exercise period and no persons other than exempted essential persons should be away from their homes on that period, on that 24-hour period. Nothing further to report overnight.
Okay, Commissioner Byrne, we do have a few questions from members of the press. We'll start with Ralph from Caymanian Times.
Good afternoon, Commissioner, and thank you for your report. Just two brief questions. Many car owners have been asked by friends or family to give them a ride to the supermarkets to do their shopping. How would you recommend that this takes place? For example, what number of persons are allowed to be in one vehicle, and what other procedures would you recommend?
So the regulations speak to people being within the alphabet range. It doesn't provide for that type of activity you've spoken to. But again, we're trying to look at the cases on a very reasonable, legitimate basis for people moving around, trying to understand the difficulties people have. So exercising common sense, tact and common sense judgment is what we're trying to do, what we're trying to achieve.
Okay, and the second one is, if by chance an officer gives an individual a ticket with the wrong details, and where can they go to have this rectified?
So all those tickets are processed through our central processing office. We have one sergeant dedicated to deal with all the files. I myself am receiving some complaints. I make a comment on the file before they go to the director. If there's a defect in the ticket, it's notified to the director, and the director will make the decision on in his legal ruling.
Thank you very much.
Okay, we move now to Wendy at CNS. Wendy, please go ahead.
Sorry, Donna, had some problems with the mic there. Commissioner, I have a couple of questions for you that have emerged as a result of what you were saying, actually, about the South Sound boardwalk. People are raising questions about because the exercising has now become so strict, like people can't go to the beach, they can't drive. People are sort of congregating in favorite spots. And the question is being raised is, are we making things worse by forcing people into smaller areas and less room for exercising? And are you concerned about that?
So the objective is to make things better. And of course, we look for people to work with us in partnership. That it's not a problem for me, it's not a problem for the government, it's a problem for everybody across the Cayman Islands to exercise social distancing. And so while we close down one area, we expect persons to be responsible and gather in groups in public places of no more than 2. And those are the regulations. And what we're asking is full cooperation for the defined periods of the curfew. And we're asking people to work with us, make sure they don't congregate in groups of more than 2 in public places, and they keep moving. The boardwalk is big enough for people to keep moving, no need to congregate.
Okay, thank you. Also, can you confirm if someone gets a ticket for a soft curfew offence, is that a criminal record?
It's something we are discussing with the courts next week. I've made arrangements for Zoom in with the Chief Magistrate and some of the key people, including the Crown Prosecution and DPP, to look and see how we're actually going to deal with this. For persons who have no criminal conviction, now a ticket is issued. What does this actually mean? So we're waiting on full interpretation. On the face of it, it's a criminal offence. We just have to see how the courts are going to deal with it.
Thanks a lot.
Okay, I do have one question. It's just a reminder, Commissioner Byrne, if you could just remind the public what times of the days that on the soft curfew days that they can go and pick up food. Just as a reminder, I know you've said this a million times, but just as a reminder, so that you're the official person, and it sounds better coming from you, more official coming from you, sir.
So the curfew is in place. As you know, the soft curfew runs from 5 a.m. in the morning till 7 in the evening. You're allowed under Regulation 8 to go and collect food, travel for the purpose of collecting food under the Regulation 8. So that effectively comes into place at 7 a.m. in the morning and closes at 6 p.m. in the evening.
And that's 6 days a week.
That's Monday to Saturday.
Thank you, sir. I really appreciate that. Okay, we're going to go to Reshma now. I believe she has some questions for you. Reshma?
Thank you, Donna. Commissioner, I know the police are policing outside of supermarkets, but we've had some concerns about social distancing protocols being followed inside the supermarkets, particularly around the cashiers' counters. Is this something that you can speak to, and if any action is being taken from your officers in terms of monitoring those types of considerations?
There is some monitoring by police, but the greater monitoring is being done by the supermarket operators themselves. And the way that's working, from an earlier meeting I've had with them through the Chamber of Commerce and the lead supermarket operators, they have a square footage calculus made out for the number of customers that can be inside. From what I've seen personally inside in the supermarkets, they work extremely well. The staff are well prepared, gloves. They have put dividers up, I think, between the checkout and the cashier to provide distancing. And that all seems to be working well, and I haven't received any complaints that social distancing is not being followed inside the supermarket themselves. And I do think that the supermarket operators are acutely aware of this.
Thank you. Just like Donna, I too have been getting questions asking for clarification. The beach issue keeps coming up over and over again, in particular now that we have the extended closures of public beaches. But the question is being asked if we have a total ban on all waters in Cayman, or can people still, if they have, say, a canal or access to the iron shore from their private property, if they would be allowed to still go into the water?
It's something we're still working through. We're dealing with public beaches, no access to public beaches, that's absolute. The issue with Iron Shore, there is no high water mark, as I understand it, speaking to marine experts. So there are little issues you have to work through, but no exemptions on the public beaches, none whatsoever. And in terms of canals, I've heard of people fishing in the morning. It's something we're just seeking further clarification on.
Okay, so we should be able to have some clarification on this in the coming days?
Yes.
Thank you.
Okay, I believe we have a question from Wendy.
Yes, please. It's for Dr. Lee. It's a follow-up on what he was saying about the testing, the drive-through testing. I was wondering, as he makes his way to the microphone, whether he could give us a bit more detail about that as a prospective thing. Because are we talking about once the frontline staff, such as HSA and the supermarket workers and food delivery people have been done, are we looking at a potential free-for-all? So if you want to get tested, you can get tested by going to a drive-through. Is that the plan?
Wendy, we haven't drawn up the plans yet, but you'll be the first to know.
But the drive-through testing would be something that is designed for an open public access kind of thing, not necessarily frontline workers.
My lord, I refer you to my earlier answer.
Okay, cool.
Wendy,
Fair
yes.
enough.
Yeah, so when we do try to roll it out, we'll probably be doing it by employment or type. We want to make it fair so that everybody would have the right access. We'll try to loosen it up for the people that have to, we deem as most needing it, but that's why I gave the earlier answer. We haven't drawn up the plans yet, and we will share them with you when we can.
Okay, thank you.
Okay, thank you, Dr. Lee. We're going to move now to our panel, beginning with our Honorable Premier.
Hello, everyone. Thank you, Donna. I am going to not read my Grim Reaper report today. For those of you who are keenly interested in it, I know there are some because they keep messaging me about it. You can message me and I'll give you whatever the details are. It's the usual trend still continuing in most countries. And the reason I want to forego that is I want to take the time to follow up on the very gripping presentation by Dr. Lee. We didn't actually plan this, that these things would coincide. But this morning, one of my sons, Dagan, showed me an article that appeared, it's a BBC-produced article, which I found so compelling that I thought I would share it with those who are listening and viewing this press conference. And it is about what a success story can look like with respect to suppressing the virus and reopening the economy, and then what can go so very wrong. There's some very, very good lessons in it. As I keep saying, to some criticism in social media, the plan that we are developing is constantly evolving because it is being informed by the lessons we are learning from what happens and is happening in other jurisdictions. We have bought ourselves a great deal of time, and that allows us I think, to be very careful and thoughtful about what we actually do. The article is entitled, once I pull it up on my phone here, Coronavirus Lockdown, Lessons from Hokaido's Second Wave of Infections. It's brand new, it's just yesterday. It was once seen as something of a success story, a region that worked to contain, trace, and isolate the virus, leading to a huge drop in numbers. But Hokkaido is in the spotlight again as it struggles to deal with the second wave of infections. In late February, Hokkaido became the first place in Japan to declare a state of emergency due to COVID-19. Schools were closed, large-scale gatherings canceled, and people encouraged to stay at home. The local government pursued the virus with determination, aggressively tracing and isolating anyone who had contact with victims. The policy worked, and by mid-March, the number of new cases had fallen back to 1 or 2 a day. On 19th of March, the state of emergency was lifted, and at the beginning of April, schools reopened. But now, just 26 days after the state of emergency was lifted, a new one has had to be imposed. Almost a success story. In the last week, Hokkaido has recorded 135 new confirmed cases of COVID-19. Unlike the first outbreak in February, there is no evidence the virus has been re-imported from outside Japan. None of the new cases are foreigners, nor have any of those infected traveled outside Japan in the last month. What does this tell us about how the virus outbreak was handled in Hokkaido? Firstly, if you get on top of it really early, you can get it under control. Quote, it is relatively easy to tackle clusters, to contact, trace, and isolate, unquote, says Professor Kendra Shibuya of King's College London. The authorities were quite successful in their cluster control approach. Japan was in the very early phase of the outbreak back then. It was localized, and it was a success story. In this respect, Hokkaido has some similarity to what happened in the South Korean city of Daegu. There, a large outbreak in a religious cult was aggressively traced. Those infected were isolated, and the outbreak was suppressed. But the second lesson from Hokkaido is much less reassuring. After the Daegu outbreak, the South Korean government began a massive testing program to try and track the epidemic. Japan has done the opposite. Even now, more than 3 months after Japan recorded its first case, it is still only testing a tiny percentage of the population. Initially, the government said it was because large-scale testing was, quote, a waste of resources. It's now had to change its tune a bit and says it will ramp up testing, but several reasons appear to have slowed it down. Firstly, Japan's health ministry fears that hospitals will be overwhelmed by people who test positive, but only have minor symptoms. And on a wider scale, the testing is the responsibility of local health centers and not on a national government level. Some of these local centers are simply not equipped with the staff or the equipment to deal with testing on a major scale. Local hotlines have been overwhelmed, and even getting a referral from a doctor is a struggle. The combination of these reasons mean authorities in Japan don't have a clear idea of how the virus is moving through the population, says Professor Shibuya. We are in the middle of an explosive phase of the outbreak, he said. The major lesson to take from Hokkaido is that even if you are successful in the containment the first time around, it is difficult to isolate and maintain the containment for a long period. Unless you expand the testing capacity, it is difficult to identify community transmission and hospital transmission. The third lesson is that this new reality is going to go on a lot longer than most people expect. Hokkaido has now had to reimpose the restrictions, though Japan's version of a COVID-19 lockdown is rather softer than those imposed elsewhere. Most people are still going to school, to work. Schools may be closed, but shops and even bars remain open. Professor Shibuya thinks without tougher measures, Japan has little hope of controlling this so-called second wave of infections now taking place, not just in Hokkaido, but across the entire country. The key lesson, he says, is even if you are successful in containment locally, but there is transmission going on in other parts of the country, as long as people are moving around, it's difficult to maintain a virus-free status. Even so, the economy in Hokkaido is already hurting badly. The island is hugely dependent on tourism, and Japan has banned travel from the US and Europe and most countries in Asia. The new state of emergency is officially due to finish on the 6th of May, the end of Japan's Golden Week holiday. But one local government official working on epidemic suppression in Hokkaido told us they may now have to keep measures in place for much longer. We feel we have to keep on doing the same thing, he said. The goal is to minimize contact between people to stop the spread of the virus. So how long does that mean? Till we find a vaccine, he says. We have to keep on trying to stop the expansion. Now, I thought that was a really, really insightful article, and there are so many parallels with Cayman, right down to the fact that they rely so heavily on tourism for their economy. But the most, I think, important message from all of that is that having suppressed the virus, which we believe we are well on the way to doing in Cayman, we absolutely have to ramp up the testing before we are in a position to reopen the economy. And even when we reopen for business, we have to continue testing. And we need to reopen in phases so that if there is a spike, we are able to identify it very quickly, move to test and to isolate the individual or individuals and their families. So that once the testing comes online, one of the things that we are certainly talking about is, I've said development and construction, we absolutely would like to see that back moving as swiftly as possible. That is very local industry. It doesn't rely on us having to bring tourists in. The people who are here already, who are tradesmen and who are already or were employed up until now, most of them are still here. It should not be too difficult to get construction projects moving again. If we can identify, get agreement to test all of the workers and all of their families and slowly open back the economy in that sort of way. It is that sort of thinking that, that is going on about how we can reopen the economy safely. There will always be risks because the virus will continue to lurk in asymptomatic people, and children in particular pose the greatest risk because they are largely asymptomatic. And that is why the view about how quickly you reopen schools is so concerning, and why we think that the longer we can leave the schools closed from a public health perspective, the better off we all are. I want to move on to talk about the response of the Department of Children and Family Services and the Ministry of Community Services, really. There have been a number of questions about that. I hope I can be able to provide those answers now, starting with an overview. Since the 14th of March, 1,842 families, or 7,368 people, have been assisted by the Needs Assessment Unit. 957 families, or 3,828 people, have been assisted with food vouchers alone, representing a 165% increase since the COVID-19 pandemic began. Pre-COVID assistance, 19 assistance was 361 families. Post-COVID-19 assistance is 957 families. Vulnerable Caymanians are being assisted with basic essential needs, which include food vouchers, school lunches, and rental assistance. A further 209 persons had their indigent medical coverage renewed. Additional financial support was provided for families with children for the continuation of school lunches. NAU frontline staff have relaxed the requirements for new applicants, and staff have been instructed to ensure that food vouchers are immediately issued to persons upon receipt of a completed application, and those whose nationality as Caymanian is confirmed. For identification purposes, NAU accepts passports, voter ID cards, birth certificates for those who have them. NAU is collaborating with the Department of Counseling and Rehabilitation, DCR, in order to support the call center. The sole purpose will be to answer phones, follow up with clients, and provide feedback. In addition to dialing 946-0024 in Grand Cayman or 948-8758 in Cayman Brac, 5 new numbers have been made available to persons on their prescribed letter day. Those with last names A to K may call 936-0628, 936-1628, or 936-2628. For last names L to Z, they may call 936-3628 or 936-4628. NAU has identified 5 additional persons who were previously employed by the NAU to be added to our support staff to further reduce any interruption in service. 2 NAU staff members will offer dedicated support to the nauinfo@gov.ky address to answer and respond to any emails submitted. As of Monday, 20th of April, improvements will be noted in the queues for assistance. In order to improve comfort, tents will be erected outside the Aqua Mall and refreshments will be distributed. 3 queues will be established catering to 3 individual groups: persons applying for food vouchers only, the elderly and disabled, including those who are pregnant, and those who seeking extended services. Additionally, 2 CBC officers and 1 retired civil servant will provide assistance ensuring adequate social distancing is maintained. With respect to work permit holders to whom some assistance has been offered, we have received 240 applications. Of these, 143 have been approved. A significant number of others are in the process of being dealt with. Of those persons approved, that is work permit holders approved for food vouchers, some 75% of those have collected their food vouchers, and we urge the remainder to come and get your vouchers. There were 36 deferrals. Seeking further information, and 6 to 1 of the applicants that are pending, new applications are pending. I would also just like to start by thanking the Chamber of Commerce and the others involved in the initiative called Resilience Cayman, which is a charitable NPO that seeks and accepts donations from members of the public to use those funds to support 4 primary community programs. A food voucher program will be made available to any resident of the Cayman Islands who is not already receiving NAU assistance. A contact person has been established with NAU to validate requests for services they receive against the allocations already made by NAU. The program also has a prepared meals component, and currently the Wharf is providing 250 meals a day to residents. The goal is to expand that to 450 meals a day. This program also provides the necessary infrastructure required to deliver food from various restaurants who are Chamber members. As of the 15th of April, they employ 6 delivery drivers, which are persons displaced by the tourism industry shutdown. Another 25 drivers will be coming online shortly. There's also the Farm Box program. This is running in partnership with local farmers in an effort to bring about a return of the farmers market, albeit online. So wellness program. This program is specifically tailored to support frontline workers. One of the examples of wellness services includes providing frontline workers with a 30-day supply of vitamin C to help support a healthy immune system. And then there's financial counseling, a program tailored to provide individual members of the community with assistance in restructuring their personal finances during this time of crisis. So that is a report on where we are in terms of offering social support to people in this most difficult time. I want to close really by thanking the Ministry of Community Affairs, Chief Officer Teresa Echenike, the Director of Children and Family Services, Paulinda Mendoza-Williams, and the team at the NAU for all of the hard work that they have been doing behind the scenes. It has taken, I think, a little longer than any of us would have liked to get this thing in full gear, but it is now moving very well and working very well. Tremendous efforts have been made to protect and care for our elderly, shut-ins, veterans, and seamen. Support has also been offered and provided to victims of domestic violence, and child safeguarding continues to be a top priority. Social workers have been redeployed to the various isolation facilities. The ministry is also processing applications for food vouchers for work permit holders. The team at NAU has been providing support to hundreds of Caymanians and indeed persons here on work permit who are also having challenges in need of financial support. And so again, I want to thank all of those involved. I also want to thank the largely unheralded staff in the Attorney General's and Solicitor General's chambers who do an immense amount of hard work drafting various things that we need, whether it is a curfew order or the shelter-in-place regulations or amendments, proposed amendments to legislation. They work incredibly hard. They're available anytime we need them, day, night, weekends. They're always there. And I also want to give a shout out to the dedicated team of senior civil servants who I have assembled to help me and the government navigate a lot of these issues and to provide policy advice. I called the team ATPM, and I told them, because they're all guys, that they asked me what it stood for, and I said, it's all the Premier's men. But I've heard them talking amongst themselves, and I think the name that they have now settled on is At the Premier's Mercy. But I want to thank my ATPM team. They work incredible hours. They work every single day. No weekends off. Even when we are not actively here, we are working in the background trying to get things done. And so I really want to a big shout out to them, Chief Officer Eric Bush, CABSEC, Sam Rose, Chief Officer Wesley Howell, Roy Tatum. I really want to thank them for the incredible work that they continue to do and the support they give me, morally as much as otherwise. Thanks, guys.
Thank you, Premier McLaughlin. Your Excellency.
Yes, thank you very much. I first of all want to just start by saying that I know we're asking an awful lot of people, particularly the recent limitations on the beach and exercising near where you live. But I do want to thank the overwhelming majority of people on our islands who are behaving incredibly responsibly in response to this crisis. And we do know this is difficult, but we do recognise the sacrifice that you're making, and do ask that you stick with us and stay with this, because that plan that we have is working. And I also thought that John Lee's presentation, which the Premier has commented on, was also extremely interesting and does underline that we have made amazing progress, but that we have to be very, very careful when we do look at how we open up. We have to do it very carefully. And I've said before that for things to change, for things to stay the same, everything has to change. And I mean by that if we want to get back to the life that we all enjoyed before, everything has to change. So because a vaccine is some way off, social distancing will be with us for a long time. Basic hygiene that we're all doing will be with us for a very long time. Protecting our elderly and vulnerable, that will be something we will have to continue to do. And so I think we have a plan. With this testing now is going to be extremely important, but we also have the ability to open up the local economy, provided we do it in the right way, but we're not at that point yet. I want to refer to the evacuation flights, and first of all, I'm afraid some bad news on that, because it's with great regret that the Nicaraguan government has this morning closed their borders and has said it will not be accepting back any citizens of Nicaragua or from anywhere else. And so I know that this is incredibly disappointing for the over 100 people who are booked to fly on Cayman Airways flights to Nicaragua tomorrow. I myself spoke to the Nicaraguan foreign minister twice this morning to try and get them to go back on this decision, but they have taken that decision because that they believe is what they need to do to protect their own country at this time. I feel really sorry for the Nicaraguans who are due to go tomorrow. I know this is going to be extremely difficult news for you. And I know that some people may need support and may need it quickly this weekend. So I've spoken to the Deputy Governor, and the number you can ring if you do need help for work permit holders is 946-0024. I apologise, it's 244800. That will be manned this weekend. And if anybody needs assistance, whether it is food vouchers or guidance, you will be able to ring that number this weekend. And Cayman Airways will be in touch with passengers who have booked flights regarding refunds. Better news, the flights to Miami today, all of that is going well. So 1 inward flight and 2 outward flights. And the flight to Canada, which the Canadian government is organising, will happen on Monday. So all of that is in good shape. Also, good news on the British Airways Airbridge. We will be organising that Airbridge in the week beginning the 27th of April. That will be probably a direct flight to Cayman. It will bring in much needed medical equipment, including extraction kits that John Lee mentioned earlier. We'll also bring back a smaller number of returning Caymanians. Please don't ring the helpline for details of that flight today. We will announce how to book tickets on that flight early next week. So there's no need for any action today to try and book tickets on that flight. But we will be organising it week beginning 27 April. And I'll leave it there. Thank you.
Minister of Health.
Hi. Thank you, Donna. Good afternoon, everyone in Cayman Brac and Grand Cayman and Little Cayman. Happy Friday. Probably not like the Fridays you're used to having, but you're here, so let's be thankful. On another note, it appears that the banks have not increased their locations or open other branches for whatever reason. Deemed by them. So it seems that we may need to increase the hours of service, as persons are now reporting to me that at 12:30 they're being told, after standing in long lines for hours, that they can't accept any more customers inside because they're closing at 1 p.m. So this is definitely something that we'll look at. because of all we've heard today, we've heard a lot, and there's been a lot from Dr. Lee and Premier and Governor and Commissioner, and you know, I think we really need to have faith at this very time. I've never been one to rely on my own strength. God has always been my source of power, and but because we have been spiritually lazy, we are now only recognizing why we need to have faith. You may hear someone say to you, have a little faith. But the biblical definition of faith is that faith is the substance of things hoped for, the evidence of things not seen. Faith is also a prerequisite for hope and love. These three remain faith, love, and hope. So in a sense, faith is belief in something and a requirement to possess other things, as found in Hebrews 11 and 1 Corinthians 13. Now, faith is hard and don't come easily. Just like the muscles in your body, faith must be exercised to grow over time. Just like any other activity into which you are growing, faith must be exercised every day. I believe at this time we need to have faith in our political leaders, faith in our pastors, faith in our scientists to find a cure, faith in our measures taken, faith in oneself, faith in our doctors. As said, faith is not easy, but we have to believe in ourselves and our ability, because our inner faith will create our external faith. We lose faith, like now with COVID-19, because we are encountering setbacks, failures in business, and fear of being infected. Fear stands for false evidence that appears real. Let's accept our current life situation with this disease. Let's accept the sadness of the situation and realize that without losing, winning isn't so great. But if we had faith as small as mustard seed, you can accomplish amazing things for God. But it doesn't stop there. The mustard seed, which is the smallest seed, needs to be watered every day for it to grow, and seemingly nothing happens for a long time. But one day, the seed will burst into the biggest tree in your garden. What a wonderful world. After all that, scripture from Psalms and Galatians, Psalms 119 and Galatians 5. It is good for me that I have been afflicted, that I might learn thy statutes. My brothers, you have been called to be free men and women in Jesus Christ. Don't abuse your freedom by living to please yourselves, but use your freedom to serve each other in love. That's really what the law of God means when it says you should love your neighbor as you love yourself. As if you keep snapping and snarling at each other, you will end up destroying one another. May God add a blessing to these words. Shout outs today to the lab staff at the HSA, DEH, and MRCU. Keep up the great work in keeping us safe. That's the lab staff. Also, shout out to the financial services staff working from home. We know you're probably working harder, but you remain employed. Thank God. We also say thanks to all the companies for finding a way to keep you employed during this time. Kudos to you. Translations today, please stay home, are as follows. In Vietnamese, Sinh Hai Unne. And in Japanese, Yene Te Kudase. Okay. Let's chat a bit about coronavirus. How would you even tell someone in your family you may possibly have the coronavirus? I bet you, if you went to a family member or a friend and said these 4 words, I have the corona. These simple words, I have the corona, I'm betting you wouldn't even get to the word virus. You wouldn't get to it in today's climate, and they would have disappeared. Gone, quick as clock. And maybe all you were trying to say to them is, I have the coronavirus cure. You see what I'm saying? And possibly we know there's a stigma. It's perhaps one of the most dangerous accelerators that exacerbates the virus outbreak. Unawareness and lack of communication can lead to an accelerated community spread between one individual to many others. But there is a few things we should keep in mind. It is not your fault that you're feeling this way, as we are in a pandemic. The coronavirus can spread extremely quickly. One contact could turn into 30 plus infected individuals. Not communicating is the same as contributing to the spread of the virus. You're actually doing people a favor by letting them know, and you could save lives in doing so. Whilst no one wants to hear that you could have possibly been exposed from the coronavirus, fostering positive communication will help contain the spread of the coronavirus by encouraging your loved ones to practice self-containment and minimize further exposure. Yes, the coronavirus is much more contagious than the flu. The disease spreads from respiratory droplets, which can travel through the air when an infected person coughs or sneezes, or from one person to person contact, meaning people have to come within 6 feet of one another. Each host could spread 2 to 4 people without even knowing. This means if you come within 6 feet of someone when you think you may have the coronavirus, they have a high chance of getting the infection from you. Knowing that you have been exposed to the coronavirus is the first step in taking measures to prevent its spread in the community. Call the hotline and they will direct you to what to do. I know you may be concerned about losing your job or being fired in some cases, but being honest to your boss could save his or her life. For example, it may be someone in your workplace tested positive, but they work in an entirely different department than you, or you may have just been in a public place where someone was coughing. You still need to keep a watchful eye for the symptoms of COVID-19. To be reminded again, infection may appear within 14 days after exposure. So fever, coughing, difficulty breathing, in some cases sore throat, or muscle aches. If you test positive for the virus in person, an in-person communication is not a good idea. So talk to your loved ones over the phone or FaceTime. Don't be scared to tell your loved ones, just say, I've been feeling a bit strange and I've got tested and I am waiting for the results, and you may want to contact public health to isolate yourself and contact others you've been in contact with. Although it's unpredictable how one will react to such sensitive news, finding out they may have been exposed to the virus, some people will be kind and understanding, while others will be sad or frustrated that you disrupted their life. But just exercise your patience with your loved ones when it comes to this conversation. But if you ever want to put things into context, there was a husband and wife married for 40 years in New Jersey who died alone in the same hospital a week apart. Entire families have been hit by this illness. All happened here was they risked it and had a small family gathering the weekend prior after an uncle's death. And the majority of 12 people at the service ended up ill. Her daughter said she hopes this story pushes others to take social distancing guidelines to heart. Now, I understand what it is to be without food, transport, sometimes hope. People I've known before are in need, and business owners are so scared to lose their livelihoods. Some know my background for 20 years now, and I am always thinking of ways that I can present to my caucus, of soft ways of opening us back up. and certain elements of kickstarting our economy. You heard the Premier earlier. Because we can't just sit here and don't think about it, as there's a lot of business heads in our government now, elected, but I keep stumbling on words like burnt out, positive cases, no vaccines. Sometimes we need to face the reality about the balance we need to take with our approach to this, and we are thinking about it every day. With God's help, we will get through this and find a way forward. Let us remember COVID-19 is the elephant in the room. We thank you for your patience. We will come through this. We are a blessed nation, and especially a country. Your leaders remember to pray and read scripture. But we will, at some point, have to set a date soon to open, because yes, it will hurt. It will hurt us not to save lives, but we can also hurt not to save the life of our future. Ladies and gentlemen, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. These are words of Dr. King. As the COVID-19 global pandemic continues to evolve, the collaboration between public and private sector has become increasingly important. It is a range of sector and critical issues related to the economy, clinical patient management, resources for the health sector, and in many other cases, one of those areas of cooperation is identifying the best treatment regimen for patients diagnosed with COVID-19 virus to maximize best patient outcome while global researchers try to develop a vaccine. In this regard, I am pleased to highlight the work being done by the Cayman Pharmacists Association, a group bringing together representatives of the entire pharmacy sector across 3 islands in the driving consensus on prescribing the medication management for patients. These public and private pharmacists have been sharing information and consulting with each other specifically regarding the scientific research of using hydrochloroquine in the treatment of patients with COVID-19. This drug, which is often used to prevent or treat malaria and other diseases such as lupus and rheumatoid arthritis, has been undergoing clinical studies as the pros and cons of using this to treat COVID-19 patients, as there continues to be divergence in the global scientific community regarding the data on patient outcome from using this drug and the treatment of patients with COVID-19. The Pharmacists Association has supported the decision of the National COVID-19 Committee on clinical guidance for the use of this drug on a case-by-case basis after the treating physician's comprehensive risk versus benefit assessment and informed discussions with patient and relatives. Another area of collaboration between our local hospitals and pharmacies is the care and treatment of our vulnerable chemotherapy patients. During the temporary closure of Health City last month, the HSA pharmacy managed the administration of the chemotherapy drugs for patients from the facility. These are all great examples of public-private partnerships taking place. Thank you to all these frontline pharmacy staff. As a quick reminder, the HSA recently opened a new refill pickup location at the Smith Road Center for Cynical members and private insurance with 100% coverage. This location only for refills made on April the 3rd. All new prescriptions will be still refilled at the main pharmacy at the Cayman Islands Hospital, regardless of your insurance cover. I thank you so much, and God bless.
Thank you.
Sorry. 2 points.
Yes.
I've been asked to repeat again the telephone number for any Nicaraguans who need support over the weekend or any work permit holders is 244-8000. So the 3 zeros. And Premier, I didn't mention this, but I think we should confirm that there will be no press conference tomorrow or Sunday. We will resume on Monday. I think we feel that we're in a good position, so we hope that's a reassuring message out there. I'm sure the press are delighted, and I'm sure the wider public are possibly quite pleased as well. And I think certainly most members of this panel are relieved too.
Okay. Thank you, Your Excellency. I had two questions, and one was for you to repeat the number. I'll begin by asking one question of the Premier, the Honourable Premier. I understand from the public in two instances, actually, that there are some employers, some people are actually getting some jobs in certain sectors that remain open, and there are some employers that are actually asking people to come in to do face-to-face interviews. How does that, what would you say to that?
Well, I think face-to-face interviews can be done safely, but as long as there's, social distancing and go the extra step and wear masks and all of that. But I would have thought that you would want to limit those interactions as much as possible and certainly encourage that. But there's some things that, unless everybody has Zoom, it's, if you're going to interview somebody for a job, you want to see what they look like, how they carry themselves, demeanor, as the judges would say.
Okay. All righty. Thank you. That's the only question from me. We're going to go to Wendy at CNS for her questions.
Thanks, Donna. Actually, this is just a follow-up from yesterday for the Premier. I just wanted to clarify something regarding the election of the Deputy Speaker. Is that vote going to be just to have a speaker for that little session that you're having, or will this be for the person to serve for the rest of the administration?
I'm glad you raised that, Wendy, because your story is wrong. The Deputy Speaker will be elected at the virtual meeting on the Thursday, and every member of the House will have an opportunity to vote on that. That's a permanent position.
Okay, great. Thank you. And
remember,
it will be permanent.
Mr. Bernie Bush resigned the position. So there's no Deputy Speaker at all. So we need to have that position filled permanently.
Okay, great. Thank you. I just wanted, that was my misunderstanding. I thought you said yesterday that you were doing the standing orders and the Deputy Speaker on the Wednesday. And then you would go to a full session of the House on the Thursday.
We're keeping, because we can't have a virtual meeting until we change the standing orders, we're forced to have a meeting, but we're keeping the numbers as small as possible, so just a quorum. But for that sole purpose of amending the standing orders and getting those approved, then when we can hold a virtual meeting, we'll do the other business, including the election of a Deputy Speaker.
Okay, great. Thank you.
No further questions from you, Wendy. We're going to move to Reshma at the Cayman Compass.
Thank you, Donna. I have a couple questions for the Governor with regards to the repatriation flights. Are there any plans to add any further U.S. flights to Miami? We've got a couple of Caymanians who are stranded there and looking forward to coming back home maybe later on this month.
I mean, I think that's more a question for the Premier and his team, but I think that the question of whether we would arrange more flights will depend on demand. I think if there is demand there, we can do more flights. So I would think there almost certainly will be more flights, because I think more people will want to leave. There will be people coming back on the British Airways flight, and some people have come back today. But whether there are more, I think that's a question for the Premier and his team.
Okay, Premier, would you like to weigh in?
Well, yes, subject to our ability to be able to deal satisfactorily and safely with the numbers coming back. So we wouldn't want to overwhelm the system and the facilities that we have, because anyone who comes back will be required to be mandatorily quarantined for a minimum of 14 days. That takes not just the facilities, but also a team of people around them to provide the necessary support. So absolutely, if there are more of our people that want to come home as this crisis drags on, we will do what we can within our means and within our ability to manage them safely.
Okay. Can you say if government is considering or is looking at implementing some sort of hazard pay for essential workers who are putting in these hours, putting their lives at risk during this pandemic, or is it something that you will consider at some point?
It is something we'll consider at some point.
Okay, and my final question, this one came in as a bit of clarity, if you can. Are marriages still allowed to be performed? Is it feasible to do this at this point in time? It's a question that's been coming from the public.
It's in the regulations, yes. It's clearly stated in the regulations.
All right, thank you. That's it for me.
Okay, Reshma, thank you. And that will wrap up today's press briefing. Again, if you want very important information, you should go online to gov.ky/coronavirus. Also, don't forget to check out eservices.gov.ky. I'd just like to make, and here on a light note, the public feels that we're all looking really good. Our hair looks great. Their hair is messy. Their nails are falling apart. And they're happy that we all look really good on TV. So there we go. All right. Of course, we thank everybody who is responsible for putting this press briefing together today. And for the entire week, we have the weekend off. We hope to see you back here. We know you'll join us back here again on Monday. Until then, bye-bye for now.
Blue serenity in yonder deep, the fear of death, but you pray, O Lord, for your soul to keep. Dear boredom, nothing but a selfish film over our eyes. Some people just don't get it. COVID-19 is a murderer, and your defiance reflects upon your character. Yes, I get it. Cabin fever is a breeding ground for depression, but I have a confession. Yes, you guessed it. We are in this together, and although our stories are not the same, they're similar enough to understand the pain. Read a book. Engage your mind. Don't give negativity the time to fester. Don't let it rule you so that K-Man 2 can see this through. Those beloved smiles that we shared with friends doesn't have to end, but you are consumed by what you do not have. When the health of K-Man is in your hands, there are many without work. They can't go to Kirk's in a panic, worry about organic. Premier says to live frugally so the repercussions don't hit so brutally. Read a book, they say. However, it is true. To discover something your mind never knew, educational absorbency in this time of uncertainty. Together, K-Man, together. Together, let's stay home, not just you alone. This is not a punishment, but a journey to success, to restore our faith in the human touch and the beauty of shared air. Together, we are a nation. Together, we are stronger.